Hello, my name is Ellie Windham, and for my 2022 Monroe project, myself and Professor Madelyn Labella conducted research on breastfeeding decisions and practices for mothers on opioid treatment medication. First and foremost, opioid treatment medication is used for people who experience opioid use disorder and have a history of addiction with either prescription opioids or street opioids. Oftentimes, mothers who are on opioid treatment medication give birth to infants experiencing opioid withdrawal. This is known as neonatal abstinence syndrome, NAS, or neonatal opioid withdrawal syndrome, NOWS. This symptom can often result in it being difficult for infants to breastfeed, gain weight, and many other things. Oftentimes, mothers on opioid treatment medication do not breastfeed their infants or only do so for a short period of time. However, breastfeeding has clear physiological benefits and can safely reduce symptoms of withdrawal in infants. The purpose of this study was to compare the intention and duration of breastfeeding between mothers with and without a history of opioid use disorder, and to understand where these differences arise. This study had two main components. The first was a baseline assessment conducted shortly before mothers gave birth, in which mothers reported how they planned to feed their child and why. This included breastfeeding, formula feeding, or combination, and asked why they wanted to breastfeed or not breastfeed. This encompassed work schedule, personal comfort, recommendations from doctors, among many other factors. Then, at 3 months postpartum, mothers reported how they were feeding their child and why, and, if applicable, an approximate end date of breastfeeding. Overall, this study compared 104 mothers who used opioid treatment medication and 72 mothers who did not. Mothers who were in the non-opioid treatment medication group could have a history of opioid use disorder, but were not excluded from this group on the basis of any history. We performed a series of t-tests and chi-square tests comparing breastfeeding intention, initiation, and reasoning. Then, we performed a binomial logistic regression predicting intention to breastfeed and a multiple linear regression predicting number of days breastfeeding by infant age 3 months. The results from our study indicate that mothers on opioid treatment medication intend and initiate breastfeeding at lower rates than mothers who are not on opioid treatment medication. Roughly half of mothers on opioid treatment medication ever initiated breastfeeding, while over 90% of mothers not on opioid treatment medication initiated breastfeeding. Additionally, mothers on opioid treatment medication breastfed on average for 32 days, while mothers not on opioid treatment medication breastfed for 64 days. Additionally, there were 8 mothers in our study who reported that they wanted to breastfeed but did not ever breastfeed. All of these women were on opioid treatment medication and cited many different factors as to why they changed their minds. Some of these included recommendations from doctors, stigma, and other factors including separation from their child. Significant predictors for breastfeeding intention and initiation were tobacco use and personal income level. Women who had lower income and higher tobacco use were less likely to initiate and intend to breastfeed. The results of this indicate that mothers on opioid treatment medication are particularly impoverished even compared to women not on opioid treatment medication who are low income. These mothers are thus more susceptible to socioeconomic pressures that may dissuade them from breastfeeding. For example, many mothers in the opioid treatment medication group were less likely to be employed or stably employed, which may have made it more difficult for them to plan when or how to breastfeed their child. Whereas mothers in the non-opioid treatment medication group may have had a more stable work schedule and were thus able to plan when to pump. Additionally, mothers on opioid treatment medication were more likely to use tobacco products. This is not surprising, as many other studies in the past have showed that roughly over 90% of women on opioid treatment medication also use tobacco products. Tobacco products are not a contraindication to breastfeeding, but may be a form of stress relief for mothers experiencing withdrawal or other complicating factors from their opioid use disorder. Finally, an important point from the study is that recommendations from a doctor, counselor, or other professional were significantly related to breastfeeding, but only for women on opioid treatment medication. Women who intended to breastfeed and then were given a recommendation for breastfeeding from their doctor were significantly more likely to initiate breastfeeding than women who did not receive said recommendation. This leads to an important conclusion, which is that trusted healthcare professionals should make strong recommendations for breastfeeding to mothers on opioid treatment medication to improve both the mother's health and their infant's health. Thank you.